Diseases. Learning about diseases. A healthy society is a nation's resource. Hence, each one of us should take care of our health. There are microorganisms around us. Some of them are useful, but some can harm us and cause diseases. They enter our body through food, water, or air. If our resistance to disease is weak, we develop the symptoms of the disease and fall ill. According to their mode of spreading, diseases can be classified into three types. Types of diseases: epidemic diseases, communicable diseases, contagious diseases. Epidemic diseases. Certain changes in the weather, contamination of water, etc. can cause many people to get the same disease simultaneously. Such a disease is called an epidemic disease. For example, cholera, typhoid, influenza or flu, diarrhea, conjunctivitis, etc. Communicable diseases. Constant sharing of space with a diseased person can result in the disease-producing germs to enter a healthy person's body through the air. Such diseases are called communicable diseases. For example, tuberculosis, influenza, etc. Contagious diseases. Germs from the diseased person's body enter a healthy person's body through direct or close contact. These diseases are called contagious diseases. Examples are scabies and eczema. In this lesson, we shall study the symptoms of various diseases and the measures for their prevention. Chickenpox. Mode of infection. A person gets chickenpox when the disease-producing virus enters the body with the air that is breathed in, or by contact with an infected person, or by using the infected person's clothes, utensils, etc. Main symptoms: high fever, headache, small boils on the skin. They look like blisters. Scabs form on them in a few days. A person does not generally get chickenpox a second time. The resistance acquired the first time is lifelong. Which vaccine did Edward Jenner discover? What prompted this discovery? Edward Jenner discovered the vaccine for smallpox. The beliefs of some cowgirls regarding the rash that appeared on their arms prompted this discovery. Polio. Mode of infection. The disease spreads through contaminated water, food, or minute particles in the air. Symptoms: fever. Throat becomes red. Strain is felt in the muscles of the back and the legs. Weakness in the muscles of the arms or legs. Growth of muscles is arrested. Muscles become flaccid and cause disability. Preventive measures: vaccination, proper medical treatment. Salk and Sabin were the scientists who succeeded in producing the polio vaccines using the polio virus. The Pulse Polio Campaign. The National Department of Health is at present running a campaign to administer the polio vaccine to the maximum possible number of children less than 5 years of age on the same day all over the country every year. During this campaign, every child in India under the age of 5 is given 2 doses of this vaccine on 2 fixed days within an interval of 6 weeks between them. These 2 doses are booster doses and have to be taken in addition to the regular ones. This campaign is expected to eradicate polio from our country. Rabies. Mode of infection. The disease is caused by the bite of an affected dog, monkey, cat, or a rabbit. Symptoms: severe headache, fever, throat muscles become rigid and contracted. There is severe pain. Patient cannot swallow liquid or even water. Fear of water, hydrophobia. Patient is delirious. Patient's limbs become flaccid and go into a spasm. The disease can be fatal. Preventive measures. Clean the wound caused by the dog bite by flushing with soap and plenty of water. Go to a doctor at once and take the required number of injections of the anti-rabies vaccine. Give all animals in your house the anti-rabies vaccine. Tuberculosis, TB. Robert Koch was the scientist who discovered the bacteria which caused this disease. Mode of infection. The germs enter the air through the spittle of the patient. The disease spreads through the air. Symptoms: cough, low-grade fever, blood in the spittle, loss of weight, pain in the chest, difficulty in breathing. Preventive measures: taking the BCG vaccination, isolating the patient. Medical treatment. At present, tuberculosis is considered to be most easily communicable disease. In India, one TB patient dies every 2 minutes. The WHO, World Health Organization, runs a tuberculosis eradication campaign. DOT, Direct Observation and Treatment Centers, have been set up for this purpose. Excellent medicines from the World Health Organization are available free of charge at these centers. Summary: vaccinations help contain, prevent an epidemic. On the basis of their mode of spreading, diseases can be classified into 3 types: epidemic diseases, communicable diseases, and contagious diseases. That was all in this topic, students. Always remember, prevention is better than cure.